Well, good morning, everybody, and welcome to our workshop on facilities. We're going to be talking about facilities that are not in the jail, out in the community. Thank you all for taking such investment in your time this morning. It's 2.5 hours. I'm not gonna diddle here in my intro, but I'm going to introduce you to Holly. And again, thanks for being here, and look forward to our brainstorming effort today.
Wonderful. Thank you, Barry. Kathy, do you want to pop up the slideshow? And then I think we're going to start with the land acknowledgement. Stephen, would you be willing to share that with us?
Glad to. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people, who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events.
Great. Thank you so much. So welcome, everybody. My name is Holly O'Neill, and I will be facilitating today's workshop along with my colleague, Marty Solomon. And many of you I've already met through working on the SAC and then previous sessions of the implementation planning process. And I also want to thank we have several people in attendance mode. So thank you. We have Andy and Atul and Bertie and Kristen and Mike. So thank you guys also for watching and for engaging with the process. So the reality is that we have so much to talk about and only so much time. So if at any point you have thoughts, and this applies both to our observers and to the folks in the meeting, if you have thoughts, you want to go ahead and email those, because we do pay attention to them and try and incorporate that into the thinking of what we're doing here. So that's the email to send it to. Our agenda for today is, I'm going to frame up a little bit of what the purpose is, and then to do the follow-up on systems and services, which mostly is actually going to be a discussion of the process that we're using, so that we're all understanding what the process is and make sure that's transparent. And then the heart of our conversation is the community facilities recommendations, as Barry noted. And then we will wind it up with next steps and closing comments. So we'll get out of here by noon at the latest. So the scope of our work, so remember, we're here to do implementation planning, and the implementation planning is based on what came out of the Whatcom County Justice Project Needs Assessment, which was a big effort over the last year and produced many recommendations, wonderful recommendations, well thought out recommendations. And so our work is to take those recommendations and come up with what are the action steps going to be, or the key projects in the next 1 to 3 years. So that's our job. Next, let's see. Yeah, next slide, please. So the needs assessment was really what emerged were 3 main areas, interrelated areas or components. And the one on facilities, for the purposes of the implementation planning, we broke into 2 parts. So there's the community services-based facilities and then the jail-based facilities. So today we're going to do the first part of that. Next slide. The workshops, as you can see, are on the schedule here. So March 30th will be the jail and accessory services discussion. The April 6th one, we're going to talk about funding, which kind of encompasses all the different projects that we might be discussing. However, we may have a scheduling conflict for April 6th, so please stay tuned. We may be moving that meeting for either Friday, that's on a Thursday, it could be Friday, or it could be the next week. So just if you intend to come to that facilities workshop, my apologies. Oh, sorry, the funding one, just stay tuned. We may have to adjust that. Next slide. Okay, so the first part of our conversation is, as I said, going to be talking about the processes, and then we're going to hop into the facilities discussion. Next slide. I want to talk now about what that means. So where we're at now, since we last met, we've been compiling your input from the worksheets and from our workshop discussion. And basically what we have right now is we have a lot of ideas. And so what we've been doing is to follow up with people who volunteered, or the groups who seemed like they were in the best position to kind of flesh things out and try and clarify what's being suggested and starting to fill in the gaps. And through that process, we're actually able to refine a lot of the ideas and see where we are finding crossover. So as we've mentioned before, even though we have a lot of recommendations, 32 recommendations, we're not trying to come up with 32 actions or 32 projects or more. What we're trying to do is coming out at the end with, say, 8 to 10 main ideas that cross over and leverage the different initiatives and recommendations. So the next slide, please, and it'll say a little bit more about that. Yeah, so if I just want to get your heads wrapped around the idea that we want to really come out of this process. The implementation plan should give us enough focus so that we aren't spread too thin, and we have a clear sense of these are the priorities that we're going to focus on, and that the priorities make sense to people, that they're like, yes, we can move on them, and then we have a budget for them, and we can see how they're going to be, what's realistic in a 1 to 3 year timeline. We'll do polling, just process wise, we'll do polling for agreement on those. And bear in mind, this is year 1 to 3, right? So we're going to have to come back. None of this material will be lost, but we'll be coming back after, say, 3 years and figuring out what we do next, because we can't do it all, obviously. And a lot of these projects are going to take a long time to get on the ground. So does anyone have any questions about the process? Well, basically, you can think of it this way. We're going to be nudging you and bugging you and trying to see if we can figure out the content and synthesize things together, test it, and they go to focus groups. Yeah. Questions on the process, Arlene? And you're muted.
I'm wondering why there are 6 additional participants today who have not attended the process of needs recommendations and so forth.
That is a great question. So the different workshops are being attended. So the IPRTF is holding the container for all of these discussions. And then subject matter experts for these various topics, workshop topics, have been invited. So let's do this. It's a good question. And since we have a little time, maybe the folks who have not been in a meeting, an implementation planning meeting yet, would be willing to turn on the screen and just introduce themselves, say who they are, and we can welcome you. So who hasn't been in a workshop yet? Who'd like to introduce themselves? And you can raise your hand to speak. Chris, yeah, go ahead.
Yeah, I'm Chris Coakdish. I'm with Unity Care Northwest. Kind of late to this situation. I got an email that was sent to our behavioral health team about just listening in, providing some feedback, because we provide behavioral health and primary medical care and substance use disorder care to Whatcom County residents.
Wonderful. Thanks for being here. And Rob, go ahead and introduce yourself.
Hey, good morning. I'm Rob Nye. I'm the facilities manager for Whatcom County. So anything that we decide to build, I will be part of.
Wonderful. Thank you for being here. Erica?
Hey, Erica Lautenbach, Director of Whatcom County Health and Community Services. I just had conflicts that I couldn't avoid the first 2 meetings.
Right, glad you made it. Rusty?
Hi, Rusty Noble, AS Facilities Manager.
Great. What facilities manager for what? Say again?
I'm the AS Facility Manager under Rob,
What does AS mean?
Administrative Services.
Great. This is a heads up for all of you. We got some feedback on our very first meeting. If people can just explain their acronyms, because we're all coming from different worlds, and this is the world of acronyms. We have pages and pages and pages of acronyms. So thank you, Rusty, for that. Okay, who's next? Who's new to the group? And Rusty, you can, there you go. Let's see. Dan's here. Who else? I think I recognize everybody else. Yeah, I think we're all here. Okay.
You've got a David Krass and a Kayla.
Yeah, David, do you want to?
Yeah,
go ahead and
Dave Kraus, I'm Deputy Chief of Services at Bellingham Police. I'm kind of tag teaming this with Chief Mertzig. I've been here before to the first one, and I'll be to the majority of them, I believe. We're working out our schedules as best we can.
Fantastic. Thanks for being here. And Kayla, you were here last time, but do you want to introduce yourself anyway?
Yeah, I'm relatively new to the group. Hi, everyone. I'm Kayla Shop-Ressler. I work in the Whatcom County Executive's Office, and I'll be supporting the executive and Tyler and Jed and this work going forward. So happy to be here with all of you.
Thank you. Okay, Arlene, anybody else whose name you don't recognize?
Thank you.
It's great. It's great. Okay, any other questions about our process before we get started? All right, so the main thing is that when Marty or I say, hey, can you give us some information, more information, please just respond, and we'll keep nudging you. So let's go ahead, and the next slide, we're going to begin with some guidelines for participation. So these should all be familiar with you if you've been on Zoom with me before. So please raise hands to be recognized to speak. Usually that's easiest if you use your raise hand button, and then remember to turn it off after you've been called on. And sharing the floor is really just it really is best if everybody participates. It makes a more interesting conversation than just having 2 or 3 people do all the talking. We want to avoid repeating ideas. So if somebody else has said it, or if you have said it, you don't need to restate it. We got it the first time. Remember that time is fleeting, so you want to avoid extra examples or long monologues. We want to really, these discussions, we're talking about implementation, so it's really focusing on what we need to do. So next steps, and boy, at our last meeting, we all walked away from that just really feeling a lot of appreciation for people stepping in saying, I'll look for that, or I can write that up, or I'll get that information. So that just makes a world of difference. It's like focusing on what we need to do and leaning in to get it done. And lastly, just keep on remembering that all these things are interconnected, right? The systems, services, and facilities, and then the funding, they are all interconnected. So just always keep that in the back of your mind. All right, so those are the guidelines, and I'm so excited today. This conversation is about facilities for community services. In the SAC meeting, I feel like we did not have enough time to really dig into this topic as much as we would have liked. So I'm just so happy we get to have this talk today. And I'm going to turn it over to my colleague, Marty Solomon, and she's going to pick up this next conversation. Go ahead, Marty.
Hey, good morning, everybody. It is so nice to see you all here. So today we're going to focus in on recommendations from the needs assessment that were about facilities for community services. And there were 3 areas, C2 through C4, needs that have recommendations about facilities. There are 6 corresponding recommendations for these needs, and they're the facilities that and recommendations that rose to the highest priority in the SAC process. And I just want to remind you all about the SIM, the sequential intercept model. And that really was the start of the prioritization process that then went to the Stakeholder Advisory Committee and was influenced what the recommendations wound up being, what the highest priority needs were, and then what the recommendations focused on. So that's where these lists kind of how they evolved. I just wanted to remind you of the history, and especially for those who weren't involved in the needs assessment process, that's where things have been coming from. On the next slide, these are the first group of recommendations. We're starting with C2, and there are recommendations 1 through 4. So recommendations 1 and 2 address the need for facilities to increase access to community mental health and substance use disorder treatment to prevent and reduce incarceration. Recommendation 3 focuses on access to reentry support services. And then recommendation 4 refers to the location of these facilities and that they need to work for all the stakeholders. We're not going to talk specifically about recommendation 4 today, but that question about location and making sure it works for all stakeholders should really be in the forefront of our thinking. And as we move through all the discussion. And next slide, let's dig in a little bit here. So the first recommendation under C2 is to explore development of a round-the-clock behavioral health urgent care facility to provide short-term mental health and substance use disorder services. And the exciting news about this recommendation is that there's been a great deal of progress on this one already. And I want to turn it over. Let's flip to the next slide and turn it over here to Tyler to tell us a little bit about the progress that has happened to date.
Yeah, good morning, everybody. Tyler Schroeder, Deputy Executive. As Marty indicated, and as the Stakeholder Advisory Committee has talked over the last many months, one of the topics that has interested in is this 24-hour behavioral health urgent care facility. I think historically we talk and think a lot about the Ann Deacon Center of Hope, the Crisis Stabilization Center, which, as we all know, is a 32-bed behavioral health facility. And there's been a lot of discussion about utilizing that for law enforcement drop-off and for having beds available kind of for anybody at any time. And that's going through crisis. And originally it started with the smaller facility, and then, as the Stakeholder Advisory Committee members know, after the Incarceration Prevention Reduction Task Force was started, kind of subsequent to the failing of the last jail levy, one of the top priorities was to build the Crisis Stabilization Center. And that brought us the Ann Deacon Center of Hope. From that comes a little bit more of a discussion about the operational needs, making sure that we have a crisis relief center that's available for anybody at any time. And I don't think yet the Crisis Stabilization Center is there. So the administration and others have been looking into this. We recognize the recommendations out of the Stakeholder Advisory Committee for this 24-hour, 7-day-a-week behavioral health urgent care. What other communities are talking about 23-hour crisis relief, having voluntary individuals go for up to 23 hours. And in discussions in Olympia, it became very clear to us that it was also very important in the legislature this year. Representative Alicia Rule, has had many conversations with Executive Sadhu and staff on the different bills that the Incarceration Prevention Reduction Task Force has been talking through, and then also recognized the momentum for state capital dollars for these types of crisis relief centers. So recognizing the momentum, although understanding also that we haven't yet come to some decisions. The county submitted a capital ask to the legislature that recently was at least included in the Senate budget that came out on Monday, which is what Marty was referring to, which is good news. There's capital dollars available for the planning of this type of behavioral health urgent care facility, a 23-hour facility. In the ask was recognizing that this type of project would look similar to other communities. King County has a project that's moving forward with Connections, I believe, is the company that is working on that. For the group that was in Nashville, we saw a very similar facility. Melora Christensen, Councilmember Buchanan, and I toured. That was a sobering center, 23-hour chairs for individuals that could utilize it when in crisis. That sobering center had about 20 beds, or 20 chairs, excuse me. Had a number of smaller private locations where people could stay if they needed, but it was mostly an open area. And then it had, that facility actually had 6 involuntary hold facilities as well, 6 rooms for involuntary holds in Nashville. It was co-located right next to their crisis stabilization center. So really what you could do is have law enforcement drop off. You could walk in if you're having crisis. There's always a chair available, at least it seems so in that manner. And then if the individual was in crisis or was indicated needed to be provided care for longer, they just had to go across the alley into the facility that was the 72 hold, 15-bed crisis stabilization, similar to the Ann Deacon Center of Hope. And then they actually had even another step-down location, which was respite, with 8-bed respite care, all on the same campus. So it really made those that were there think about the co-location at the Ann Deacon Center of Hope and how a crisis relief center could accomplish what we've been looking for, is open chairs, open beds for individuals that are in need at the time that they're in need. And so we're excited to recognize that at least there is some momentum in Olympia on this topic, and a capital ask for pre-planning if this group and then if the county agrees that we really want to take the next step. There's some capital dollars available for us to further define the location and the size and the cost and everything associated with it. So thank you, Marty and Holly. Hopefully that was helpful. If there's any other details or questions, I'm happy to answer.
That's great, Tyler. And we had some of those details of what went into the proposal on the next slide. If you want to click to that, Kathy. And again, this, as Tyler said, this was just what was put in this proposal. I'm just seeing where it will go and then refine as possible. And I think Michael might have a question about this.
I know this is a discussion of facilities, but I'm wondering if Tyler or someone else can answer. How can these be more than just 23-hour place for people to be, but ways of connecting them to services? And if they do transfer to the next level, how do those services continue? Right, we're not just trying to create beds or chairs, but hopefully services to the person, so the person's trajectory and their life changes. I assume that's always part of the model. Is that well understood, and what would that look like?
Yeah, it's well understood to me, and you're absolutely right, Councilmember Lilliquist, it's a part of the model. I may not be the best person to speak to the services, to the behavioral health component. I'm happy to do so, but I'm not sure if others on the call have a better understanding to it and probably more appropriately to speak to it.
Yeah, Arlene, and then Melora.
There are several really important issues that have been addressed in all of our research for what is needed. And one is, of course, the wait times, which this system eliminates. And that is actually quite stunning, since we can't seem to do anything about it in any of the areas of treatment that we know about. So that is very significant for heading off crisis, for prevention of crime, and for preventing trauma in the clients that we see. The other thing that you're asking about is how much services will be included in this process. So if we do it with gaps in it, it's not going to do us much good to just recreate the same problem that we have here. So it needs to be done in a thorough manner. So that means evaluation, assessment, immediate care to speak to someone if needed, and then a plan for treatment, and possibly the capacity for treatment within this location. In addition, side services such as housing issues and health issues and so forth ought to be included.
Yeah, thank you, Arlene. Melora?
Yeah, I would just add that, it's about the continuum of care and the coordination of services. So whenever someone is in a location where they're safe and stable and have their basic needs met, it's an opportunity for services to connect. Someone being there for less than 24 hours might not mean there's a treatment plan by the time they leave, but it is a start. And when I think about all of the teams that we have out in the field, doing outreach, connecting with people, when we don't have someone somewhere to take someone where we can be warm, get some food, maybe take a nap, have a conversation, that changes the whole situation for that individual. And people are in a completely different place to have conversations and think about next steps. And right now we don't have that outside of, base camp, or even getting someone into the crisis stabilization center is a different type of intake, right? This is about being able to get someone to the place where they can have that conversation about what they might be willing to do. So I would argue that we really need to have services available to come in and out as people show interest, and that it's kind of built into the model.
Thank you. Other questions at this point or comments? Tyler, are there other things you'd like to share? Yeah.
No, my only other comment or thought is, at the last meeting, we talked a little bit about where we as a community want to intervene in people that are in crisis. And is it at the jail, which we have historically, or is it at this type of facility? And I think we all recognize that it would be this type of facility, which is where we as a community and the values that we bring, where we want to help intervene to get people into that continuum of care. So it really recognized, it really kind of struck home with myself, and I think others that were able to see it in person, about how it actually functions and how it fits within this whole crazy constructs that we're trying to figure out, being kind of behavioral health and criminal justice and how they overlap. So I just wanted to recommend that. Thank you, Holly.
Thank you. Yeah, Peter?
Tyler, you mentioned that the facility that the three of you saw in Nashville had 6 6 beds for involuntary hold. Could somebody speak to whether this facility as proposed could or should have such a capability?
Mildora?
Peter, so I don't know enough about how the involuntary detention laws work in Tennessee, but it was clear that they were functioning the way that our hospital functions for those 6 beds. So mental health co-op, they also run crisis teams and their version of DCRs, the designated crisis responders, who are able to do those custody authorizations and put people on a hold. So they were actually able to bring them into this facility and they could be there for up to 72 hours or longer if they were awaiting a bed. And one of the challenges we have in our community is if we have someone at the hospital on a 72-hour hold and we can't find a bed, legally those folks have to be let go from the hospital. So there's some nuances around state law that I'm not sure about, but we are hoping to meet with Mental Health Co-op and understand more about how they got that certification and licensure.
Great. We look forward to hearing that. That sounds like it'd be important. Yeah, Doug?
Yeah, I know as far as our behavioral health deputy program and just deputies in the field, historically, when they have probable cause that somebody is imminent danger to themselves or others, they are able to take them into protective custody, and we would take them to the hospital. When the Ann Deacon Center for Hope was in the planning stages, the understanding was that would become an involuntary facility. And I know as things move forward, that wasn't the case. We've kind of progressed to the point where there's the ability to take somebody there and hold them for 12 hours. But again, logistically, it just, there's no capacity there to hold somebody involuntarily. If they want to leave, they're going to be allowed to exit the facility. So having a 24/7 facility that can hold somebody and it's actually designated as an involuntary facility would be highly beneficial. And then the other point to have that open is, we run into a lot of people that don't quite meet those ITA, those protective custody criteria. And if they're not willing to go, we basically have to walk away. So because there's really not a good facility to take them to. So having somewhere that has multiple services would benefit us, and we're standing up the co-responder program as well. So I think that would help the community as a whole.
Thank you, Doug. Could you, for the group, just remind us what ITA stands for?
Involuntary Treatment Act.
Great, thank you. Okay, Mike?
Yeah, good morning. Thanks. EMS, a similar deal. We had a high expectation for a drop off from EMS from the field. We've been wanting to divert from the ED for a long amount of time and had a lot of hope for that. However, our choke point is that EMS just doesn't have the time to spend the 2 or 3 hours it takes to do a workup and intake on a patient. And it's really not their skill set either. So this facility would offer a great benefit for EMS. So even if there was an ITA, a lot of times EMS may be transporting that patient for law enforcement as well. So we need to be able to facilitate this. What we've been talking about was this 15-minute handoff that looks a little bit more like an emergency department handoff, but specialized in this particular area. And in addition, one of the things that's kind of holding us up for a project is we are talking about delivering medical assisted treatment sort of in the field through our ART teams. And maybe being able to redirect people that overdose from the ED that are stable to this facility as well. We feel like it'd be a much better narrative for the community, and it'd take the load off the ED, and you'd probably get a little bit better, I would hope, more better outcomes from an engagement from that process as opposed to what we're doing now. So thanks for that.
Thanks, Mike. Lisa?
I just wanted to clarify that the law changed and it's not a 72-hour hold. It's a 120-hour hold now. So it's a 5-day initial hold for ITAs.
Great. Seems like an important clarification. Excellent. Okay, Brian? Yeah, I think you might be muted, Brian. Can't tell. Doesn't look like you're muted, but I can't hear you. Try again. Not yet.
Mm.
Oh. Say a little more. I thought I heard you for a second. Brian, another thing, why don't you try turning off your video for a sec? Maybe it's a bandwidth issue. Because you're doing a little bit of freeze frame.
Nothing.
Oh, there it is. Yes, you're on. Go ahead. I heard you.
We had you, Brian. We had you.
I think he's gonna log in again.
Okay. We'll come
Come
back
back to him.
Yeah. All right, other thoughts here. Great discussion. Other things that people want to chime in here about what feels important about this recommendation and the steps to move it forward. Yeah, Arlene?
To me, it's extremely important that the lack of barriers to entry and care is just invaluable for us and rare. So, but also it's addressing Whatcom County's equity issues that anyone can come in, whether they have money or they don't have money, or they have insurance or they don't have insurance. I mean, this is so rare to have that and so valuable.
Yeah, thank you. Okay, Brian, you want to give it a shot again?
Well, hopefully this works now.
Yes.
Yeah, it's only been 3 years of virtual meetings. So I just wanted to ask, is this facility imagined as, is it a pre or like a post-arrest diversion before a pre-trial or some sort of sentencing, or is it imagined as at any time an individual in crisis could be either, I suppose, check themselves in, or is it like a post-law enforcement action?
Great question. Tyler, can you answer that?
Arlene, do you want to answer?
Yeah, I'm happy to answer. It's pre everything.
So what is the mechanism then that an individual in crisis would be made aware of this facility?
Well, we're not there yet. How we're going to let people know? Is that what you mean?
Well, in part, I guess I'm just wondering. I think there's broad agreement, obviously in that this facility is needed, but how are the folks in need getting made available to this service?
Well, obviously, we're starting to do a lot of outreach about what our services are. This is something that's important for county administration to be doing anyways, which is to let people know what's available for them. And it hasn't been done too much in the past, and it needs to be done. So we've actually begun that process with the communications company that is starting to work on it. And I think mostly it will be people who are doing outreach, and they've already talked about the value to them, but anybody will be able to refer themselves. They can come, just come.
So efforts of the HOT team, efforts of Grace, ART, all of those flow into this facility. Okay, thank you.
Great. Tyler?
Yeah, just to build off of that, that's right, Brian. It's those existing programs that we started up over the last couple of years, the HOT team, the homeless outreach team, the alternative response team, the GRACE team, which I would tell you what that means, ground response, something, Melora will have to answer. All of those that are kind of on the street, recognizing these individuals that are in crisis. It's envisioned that it would be for walk-in. It's envisioned that it would be for drop-off from first responders, from law enforcement, from EMS, from the group of the kind of alternative response that we are creating since 2017 that our community is really invested in. And likely also through those that are calling 988, kind of calling dispatch and recognizing, or WACOM or 988 and recognizing that they're not as much they're in behavioral health crisis. And so there would be some discussion that this would be an opportunity for those individuals to go. So that's how it's envisioned.
Great, thank you. Melora?
And I would just add to that, Brian, that, right now with the Crisis Stabilization Center, either maybe there are no beds, or maybe the person doesn't meet the criteria of our medical detox, or they don't meet the criteria of the crisis triage space. So for first responders to have to try to figure out which side they need to go to and to kind of do that intake in the moment, this would allow them to be able to go to a place where that work could be done while they're in a chair, they're warm, they have their basic needs met, and then we could work on getting them into the Crisis Stabilization Center. So it's that, to Arlene's point, it's that let's get you into where you need to be, but we know that sometimes that takes a little longer than is going to work for first responders. It works better for our outreach teams like Grace and Lead and HOT, but of course, those are just during the day. Having this be a 24/7 facility would be key.
Right. Really appreciate the amount of thinking that's already gone into this project. So is there anything else people have to say that they would like to share before we move on to the next recommendation? Okay, yeah, Stephen.
Just a question, maybe for Laura or Tyler or the Nashville crew. I certainly understand the value of this as the drop-off point and an accessible entry point when any of the field teams, the HOT team, MCOT, whatever, are escorting people there. But it's also referred to as a walk-in kind of place, and at the same time, it's stuck way out in Iron Gate, which I don't think is an accessible walk-in location to somebody in crisis unless they're accompanied by somebody. So in one sense, that calls for a centralized location where more people in crisis exist, which would be in town. And I'm just wondering, I don't know how Nashville was located, and I don't know what site implications this kind of 23-hour entry point would have in our thinking. I know that's not the focus of today, but I'm just wondering if anybody has any thoughts of that sort of disconnect with a walk-in kind of concept.
Thanks, Stephen. Great question. Barry?
I can just speak for what we saw in Nashville, as you just asked, Stephen. It was similar to what a division might be. It was kind of in its own little park. But it was all co-located on the same campus with a pharmacy as well. So they had a lot of resources right there on that campus. They had an extensive transportation effort, not only just to go to this center, but all around their corrections campuses. So that would be important to have, a good solid transportation system in place to shuttle folks around. If there is some disconnect, like as you said, Stephen, with like a downtown walk-in kind of location.
Yeah, great. Arlene?
Yes, I worked at Crisis Stabilization for 9 years, so I was at the Division Street location. There is a bus stop right in front of the center, at least there was at that time. And we used to give people who needed, to go to appointments and things, bus passes. But my understanding is that it's about 2 miles from downtown. It's not exactly in the hinterlands. It's an semi-industrial location, which means there won't be any likely resistance in the community around to making it and building it there. So to me, it's a legitimate choice.
Great. Thank you. Okay, Brian. Mhm.
I'm wondering if Barry could speak to, from that Nashville model, it's that campus's proximity to the downtown area of Nashville. And then I guess I would ask for others who are much more versed in this than I am, what is even the prevalence of someone self-selecting and saying, you know, reaching that point where they want to avail themselves in a walk-in sort of model? Because I guess what I'm hearing is that this is imagined as there's probably going to be a couple of touches from some of the other acronyms that are serving, you know, communities in crisis or community members in crisis, in addition to our first responders.
Barry,
I'll let Melora or someone take that second piece. That's much more technical. But the first piece, as far as how far, it's kind of hard to judge because our driver kind of got disoriented and turned around a couple times. But I would say it was within the same approximate distance as downtown to Division. It took us about 15 minutes, I guess, maybe, to get there. And that was with a few, you know, like I said, a few navigational issues. So
thanks, Laura.
Yeah, I would agree. It was about 15-minute drive. Brian, I think that your point is well taken. We might not have a ton of walk-ins. I'm thinking even just about the Crisis Stabilization Center right now. You know, of course, it's open to walk-ins as well. And we could kind of dig into some of that data, what we see there. But in general, I think that we would want to make sure that all of our services across the county were very aware that that was a resource and knew how to get someone there with transportation support. Because I do think that often there is that human connection that's just, you know, hey, do you want to go somewhere and just take a break and we'll go with you, and, you know, or here's a picture of it, this is what you're going to get there. Often it's helpful. And then I think once people are aware that it's a resource, it might be utilized more. But I think it is good to recognize that the library, base camp, you know, downtown will continue to have people kind of stuck there in crisis, and they might need that assistance to get to the next step.
Yeah, that was really helpful. Darlene, go ahead.
I would just add, from years in probation and working in criminal justice, that people accessing facilities really is a barrier. For instance, the Division Street property, for years, there was a bus in the morning and a bus in the afternoon. And if you got somebody out there, even if we gave them bus passes, they had to wait and wait to get back. And so getting them back a second time or getting them out there was really a challenge. So I think if something like this were to be considered, it'd be very important to work with perhaps WTA and make sure that there were frequent availability for bus schedules or other things, so that it really would be user friendly, because that has definitely been a barrier in the past.
Yeah, good point. So really reinforcing that this would need to be really integrated with, you know, the question of how do people get there. Good. Okay, Mike, and then Wendy.
Yeah, I just want to say 2 points. I remember about almost 4 years ago, there was a really long line of people that testified to the county council regarding the availability of walk-in mental health services. And as the people were testifying and saying, you know, what all these blockades were, it all went back to, there's no place to walk in on a given day where I can get my loved ones seen for a mental health specific. I have to go to the ED and I have to wait an extremely long time. And if I get seen in the ED, that's not necessarily going to get referred to something that's going to be helpful. So I don't remember the date on that, but there were, if I remember, more than 40 or 50 people that testified to that effect. So I do think there is a great opportunity for a walk-in center. My second point is that, yeah, I know from our EMS division and the RSD division has come up, especially during the pandemic, transportation was a big problem. We're tackling that a little bit with transportation service that's funded out of this, going into this new year on that. So I think we'd have the availability, at least for the patients that we're taking care of, to move them around. And then any special situations, I think we can respond to that and build on that by the time this facility would be built. Thanks.
Thanks, Mike. Wendy?
Two things real quick. One is the advantage I see of the proposed location is that the stabilization center is really already there. And it has a very large kitchen. So you're going to need to feed the folks who are in the new facility, and they would most probably be able to do it. And if it was right next door, it's going to be easy to move the meals over. And the second point has just flown out of my head. So never mind, it couldn't have been that important. But if I remember, I'll send an email or something. Sorry about that, everybody.
That's so great. That's good. All right, Barry?
Another idea that's been kind of kicked around just in some conversations is a downtown resource center of some sort that could have maybe an intake window, intake door, where people could come in, walk in if they're in crisis, and then be, go into a process and be able to have transportation out to if there was a facility out. So I think, thinking creatively about what a resource center might look like is something that's high on my priority list.
And that one's coming right up in the slides after the next ones.
Okay.
We'll talk about that today.
Do you remember your other thought?
Yeah, it was just real quick. WTA will be more responsive about putting more frequent buses when the number of people who are going to be using it increases. So this would be rapid turnover for a lot of folks. It's going to increase the probability that they're going to be willing to work with the county and the city as far as increasing the number of trips. So thank you.
Thanks, Wendy. Is that Paul?
I was going to say we are about to open our way station, and we should use technology like Uber. We could have something like this that where if they come in and somebody can say, okay, here's a car, go get there. Thank you.
Yeah, great. Michael, and then Scott, and then Erica.
Well,
Michael?
I hesitate to speak for WTA, but I am the president of the WTA board, and several other board members are here. WTA service could be increased. It could either be increased sort of organically by WTA when it sees the need, or it can be increased if there is a request from the county and funding that goes with it. The City of Bellingham, for example, has bought extra service at times from WTA, so it's an interlocal agreement. So it might be possible to bootstrap bus service to expanded facilities. I just wouldn't write that off as a possibility, but in general, WTA will follow the demand rather than lead it, but there is a way to bootstrap, I believe.
Thank you, Michael. Scott?
Michael stole my thunder. I was going to say a similar thing about I'm on WTA board, and I know that we would support any need in the community.
So great. I'm really glad there's a number of you here to be part of this conversation. Erica?
Yes, I'm sorry, I got a phone call I had to take, so I hope this wasn't mentioned, but Mike Hilly proposed a really innovative idea and has transportation folks that are running people from here to there and back again. And we are taking on a more permanent position at the Health and Community Services Department to have that function as well. So that transportation person could take people from the jail to the Crisis Stabilization Center, or this facility to there, or respite to one of those facilities as well, just as another option. Someone dedicated who also has some skills to be able to manage through any of the issues that might arise with some of these folks.
Yeah, that's fantastic. Is this something that is for sure already going to be established? Wow, that is wonderful news. Thank you. Okay. I think we should probably move on. So are we ready? Can we shift to the next set? All right.
Yeah, and just to close out that last one, what I heard was a remaining question about whether involuntary holds or space for involuntary holds might be desirable and possible in this space. And so I'm thinking that that's a question for further research. And if you already know the answer, or if you know where to go for the answer, can you just let us know so we can learn more about that? And then my other thought, and feel free to raise your hand or just send an email. And then my other thought is just, it seems like from this conversation, there's quite a lot of support for this concept. It's fantastic that there's already this proposal kind of crafted. And so even if the funding in this round doesn't come through as desired, we've got a lot of steam going into seeking resources, other resources. So that's fantastic. Really good momentum. All right, now we're going to just totally shift gears here to C2, Rec 2, which is about researching the feasibility and desirability of building a regional secure detox facility for people with substance use disorders who are considered a risk to public safety. This recommendation is really similar to the one about a regional inpatient competency restoration facility that we discussed a couple of weeks ago, A1, Rec 1. And so it doesn't say, just both of them don't say that we should fund and build a facility. What they're talking about is studying the feasibility and desirability of building a facility. So that's where our focus is on the studying part. So if we move to the next slide, people had a few on the worksheets, people kind of riffed on the theme of a regional secure detox facility and had a few variations on the idea that I've listed on this slide. So one was inpatient substance use disorder facility with integrated sobering and diversion. Second, a combined mental health and substance use disorder secure inpatient facility to accommodate co-occurring disorders. And third is a separate local facility for juveniles with co-occurring disorders or treatment capacity for both, I guess, mental health and substance use disorders. So just wanted to open it up here for any other ideas about variations on a regional secure detox facility and see what you have. Yeah, Ryan.
I might ask Tyler to jump in here, and at risk of going back in time, I believe the 17 jail initiative proposed a 38-bed facility, and it feels like this one, if we're talking about a regional secure facility, this would be post-arrest or even post-sentencing. And maybe just ask folks to chime in if I'm understanding that correctly, because that's, I guess, full disclosure, that's how I'm thinking about it, is that this is a facility that would be part of the jail and would be perhaps how those individuals get the first access, or maybe not first, but continued access to treatment options.
Thoughts? Yeah, Arlene?
I mean, I think that's what we're trying to do here, is to make those decisions, because you have these suggestions are different one from the other. And it may be that we need to do several things, but, you know, regarding like the separate facility for juveniles, I understand that the people who run Touchstone in Blaine are building a place for young people that should theoretically address mental health and SUD both, but I can't swear to exactly what they're going to be covering, but I know that that's beginning, that process is beginning already. I think we want this, we need both. I mean, we need it for people who are in jail and for people who we don't want to have to go to jail. So the prevention, on the prevention end.
Thank you. Tyler?
Yeah, I was just going to recognize, Brian, you're right. Back in the 17 jail conversation, there was a number of beds identified within the jail facility, within the correctional facility for medical purposes. And individuals that have been arrested that need that level of care that currently the facility just can't accomplish because of the lack of adequate space. We have been talking about and will likely next week kind of further define what that looks like in the facility. I think, as Arlene pointed out, this is a little bit more of an out of the jail facility, regional secure detox facility that I want to emphasize the point regional because I really think working with North Sound Behavioral Health ASO to further define this as kind of what the advisory committee was recognized, because I don't think it's something the county can take on, or our community, when I say a county, I mean our community, can take on ourselves. We really need to partner and leverage the North Sound interest into where it goes. So I do see them separately, Brian, just to kind of recognize your question. And that we need to make that decision about in the facility, yes, but also outside, how do we accomplish that?
Great, thanks. Laura?
I was just going to add a little context. So in Washington State, we have Ricky's Law, which is Involuntary Treatment Act for substance use disorder. My understanding is we only have one facility in the state that is able to do that. And something to note about inpatient treatment beds and crisis stabilization center beds is that they can be accessed from anywhere in the state. And that has to do with the way that the reimbursement works. So sometimes even here at the Ann Deacon Center for Hope, we might have people from Tacoma, or we might have people from Spokane. We send people in our programs to inpatient treatment facilities all over the state. So that's just something to keep in mind with these facilities and the way in which the state reimburses for services.
Great, thanks. That was helpful. Michael?
I'll try not to repeat. One, rather late yesterday, I added some links on secure detox facilities, which sort of went over what Melora was just talking about. There are state rules on these. We should follow them. And I really want to emphasize or revisit or reinforce what the point Brian made. There's the degree to which we have a secure detox facility and its capacity determines the degree to which we will need similar facilities within the jail itself. I think ideally, we wouldn't have to have a large number of beds set aside in the jail, though we need some, if we have a regional facility. So I mean, I really appreciate Brian bringing up that point. Whatever we can do on this end determines what will happen on the jail end.
Thank you. Okay, I see Brian.
Yeah, just quickly, I guess what I was focusing on was a previous slide that suggested that these were folks who were a threat to public safety. And then on this side, in the headline, it's secure detox facility. Where my mind went was thinking about that larger facility. If these folks are a threat, or if they're in the jail themselves, there's already going to be corrections officers there. So that's I guess what I was trying to highlight. And then I just wanted to underscore something that Tyler said, that around regional partnerships, and I think Stephen raised this at our last meeting, that a lot of these solutions and a lot of things we're talking about, we don't fundamentally control. We need corresponding support from various state and perhaps federal sources or agencies.
Thank you. So we've got, Donnell got bumped into the attendees list when he moved to the phone somehow. So Donnell, I think you can speak. Do you want to jump in?
Yes, I do. I just want to
comment to what Arlene said. So Touchstone Behavioral in Blaine, they did receive a grant from the state's Behavioral Health Facilities Capital Program, whereby they will be building a facility for intensive youth intensive youth outpatient treatment, crisis stabilization, and triage. So that's up in the Blaine area. So that is a fact. Thank you.
Great, thanks for that. All right, Stephen, you're up.
Two quick thoughts just to underline what I think are key elements here on the slide. The research is extraordinarily strong and broad, that most of the people we deal with have co-occurring disorders. And one of the barriers of serving these people is bumping them back and forth between systems that are siloed. So the emphasis on a facility that can respond to both behavioral health and substance use disorder needs is absolutely critical. That involves building in cross-training of staff, certifications, and breaking down the wall between, like we have between the sides of the Crisis Stabilization Center, in some way seems really critical to this. The second point I just want to make is all of these seem like good ideas to me. They are, as I think Arlene said, slightly different. And I just want to reemphasize that we're talking now about a 1 to 3 year time frame. We're not going to do all of these in 1 to 3 years. So we need to think about what's the first piece, or what's the most important piece, or what's the most impactful piece. And that ought to be a part of our planning.
Yeah, I'm remembering too that at the first slide on this, it was research, that the task really and the recommendation was about research for something that would be a longer term. So your point, thank you for flagging that, Stephen. So let's hear from Wendy and then jump to the next slide just to make life even more complicated. Go ahead, Wendy.
Basically, I just wanted to make sure everybody's on the same page. All of these services will need to be duplicated in the jail. We provide them now, not to the extent that they need to be, but there will be, it doesn't matter how many of these we were to construct or how many beds are maybe available in the state, there will be a segment of the population that needs to be in custody for a whole variety of reasons. And those decisions are not made by jail staff, they're made by the courts at some point. So all of this stuff, we do it on a day-to-day basis now with insufficient resources. And so if it can divert some of the folks who wind up here because their behavior continues to escalate because there's not a place like this, that would be terrific, because then there are no victims in that case, and that's better for the entire community. But please, I'm asking everybody to keep in mind that we need a medical unit within the jail, because this is a big part of what we deal with, but we also have people who have multiple different other healthcare issues that also need to be dealt with. Thank you.
Yeah, thanks for helping us bear that in mind. Okay, let's shift to the next slide and just keep this, or you kind of throw this out. Marty, do you want to kind of tee us up?
Yeah, this was just a question about how these pieces might fit together. So as Stephen reminded us, this is a research project here. We are needing to figure things out. And what is the desirability and feasibility of a regional secure detox facility? Does that make sense? And does that go along with the competency restoration facility in some way? And Wendy's shaking her head no, Caleb's shaking his head no. So they're two different facilities. The research part may need to be separate as well. I don't know. Let's switch to the next slide, which is, what needs to happen to learn about the feasibility and desirability of a secure regional detox facility. And do we want to try to pursue this now at this time in this first 1 to 3 years. So those services, some ideas about how to research this that came from the slides or my head are clarify the needed services that this place would provide, understand the regulations for each type of service. So are we talking voluntary, involuntary, short-term, court mandated monitoring, et cetera? So what are the regulations for each type of service it would provide? And then another step would be discussing this with North Sound Behavioral Health and visiting model programs. And so I just wanted to hear your thoughts about any other suggestions for determining feasibility and desirability. Arlene?
Yes, my research comes from working in a triage next door to SUD services, and sometimes mingled. And what I learned from doing actually a support group for both sides of the programs was that there are certain individuals whose addictions are so long, 30 years, 40 years, that to put them into a month program is not a serious actual treatment. In other words, you can guess how much time in treatment a person might need with that kind of a background. I'm not saying that happens a lot, but it does happen. So we're not even addressing that. There are a few places around the state, but very, very few. So that isn't being touched. But the co-occurring issue was very common amongst the SUD clients, maybe a little bit less so for the mental health clients, but it's true that they mostly ran together. So that was always important.
Great, thank you. Yeah, Wendy?
There's actually quite a few things that have been stumbling across on the web. There was a research paper that was put out under SAMHSA that talks about the effectiveness of jail diversion programs for mentally ill, and they talked about some things to consider. There is a new facility that is opening up this year. It may be open by now. It's in Miami, and it is really designed to divert people from the jail system, focusing primarily on mental health, but they include people who have co-occurring, and the scale would be much larger than something we would want to even look at because Miami is much huger. But I'm continuing to do this on off time. I just didn't get a chance to fill in the spreadsheet because I was out the first 3 days of this week. But I think it will be useful because this is the same topic that's coming up for a lot of other people in the United States, to find out what some of the steps that they've taken, costs that are involved, not only in construction, but operations, and all of that would tie in. I don't know that it would take a huge amount of time. And the third thing is that I believe the community college has a program, they used to, if they didn't lose it during COVID, that they would assist entities, especially governmental entities, in doing research. And I can dig that contact up if people are interested, because it didn't cost anybody. They did it as part of, like an internship. And so the subject was the end product. So they would benefit from it. We would benefit from it because we wouldn't have to be depending on all of the folks at this meeting doing the additional research. So it might be something to consider.
Great, thanks for that. And yeah, go ahead, even if you can't get it on the worksheet, send that example via email if you would, because that sounds great to model. So, who's doing things that might be at least relevant to our work. Yeah, Barry?
So on the North Sound bullet, the North Sound is going to be going through a leadership change this summer. I'm on their selection committee to select a new executive director. And, Melora and I talked a little bit about maybe how could we put together a framework of how they could be involved in this kind of work, to be able to bring that to them as they are going to be probably open to, some new ideas. So I'm looking forward to that, sitting down with Melora after we kind of go through this process and get some basic ideas of how they might be able to help in this effort in a regional way. So that's definitely under discussion.
Great, thank you. Peter?
Over the last couple slides, it looks like there are probably 4 different facilities that really need to be researched. And I'm wondering if somebody could speak to what the process is going to be, or how much workforce we have to do this research, because all of these things are critical to our success. And as we have a community conversation about the jail, it's going to be critical that we have made progress soon on moving these plans forward. So if somebody could speak to the workforce for doing all this research, that would be great.
Right. Tyler, you want to pick that one up as well? I saw your hand was up.
No, did you see how quickly I dropped my hand?
I did notice.
That was on purpose.
Okay, then you're off the hook. Hold on. Does anyone else, and then you can get back on the hook. Anybody else have a response to Peter's question there?
Yeah, I guess I
I have a
can.
response.
Oh, go ahead, Tyler, please.
No, Erica, you're up. You're up. I think it'll be very similar.
Well, I think it's helpful for us to understand where the priorities are. And, we already have existing good relationships with the BHASO and others. So I think we just need to figure out internally how we can get some of the answers that we're seeking with the existing staff that we have.
Thanks. Tyler, do you want to go? And then we'll hear from Stephen.
Sure, unless Stephen had something specifically to Peter's question.
Yeah, what I was going to say, and this sort of demonstrates the porous nature between these subjects, because I know we're on community services facilities, but as Wendy said, a lot of this has to coordinate within jail facilities and so forth. One of the key pieces in terms of the research task and the regulatory structure we're in here, as well as the relationships with the ASO and the state, is the fact that right now there's no Medicaid reimbursement for in-jail services. And that's a huge obstacle, as well as a cost drain on the county if we're responsible for all those services. California just got a waiver to Medicaid law to be able to cover certain services during incarceration. Those are available, but they deal with really intransigent bureaucracies, the Health and Human Services on the federal level and the Healthcare Authority here on the state level. Kayla's starting to put together a group of people to look at that. I would urge that we give that the highest priority because of the many ways in which it could facilitate some of these discussions and frame out what's possible and what's not. I would just start those conversations and research ASAP and really put some effort into that. That's obviously got to come out of the government side of things, whether it's the executive office with Kayla's leadership, or the health and community services side with Erica, or both. But I think that would be one place to concentrate on as soon as we can.
Thank you, Stephen. Tyler, you want to jump in now?
Yeah, sure. I was just going to kind of concur with what Councilmember Buchanan said. Just recognizing the North Sound BHASO's kind of leadership transition, but also just recognizing that it's really important for this group and to provide clarity to the community to to kind of Peter's question, that this is a regional conversation. The secure detox facilities is not a lift that can be done just by our county with the structure and the framework that we have associated with it. And since the Stakeholder Advisory Committee's recommendation came out to research, and even today, North Sound has come out with a needs assessment that talks through and recognizes the need for inpatient detox and other services. So, you know, my recommendation for this implementation plan would be to point to that process and to be more engaged maybe in that process on the regional conversation, and not really get bogged down and almost have it as a lower priority. So I already talked about priorities as it relates to the implementation plan, because over the next 1 to 3 years, we really can do that work regionally. We can talk with North Sound about how, if we have a property in our community that is appropriate for it, and to Stephen's point, which is a great one, and the Medicaid conversation, the costs associated with it. But this whole topic is one that I would really want to, in the 1 to 3 years of the implementation plan, point to that North Sound BHO state level conversations and continue the research associated with it and identify a group to really participate in it.
Thank you. Kayla, I saw you nodding your head there at one point. Did you want to jump in? Have any?
I'm just always agreeing with Tyler. That's it.
Great. Okay. So really clarifying points. Thank you both, Stephen and Tyler, for those. Are we ready to move on? We've got 2 more hunks to go, and our timing's good. So Marty, is there anything you feel like you would like to clarify on this conversation before we shift?
I'm still a little bit, I'm still questioning whether competency restoration, the research on the feasibility and desirability of a competency restoration facility is related in any way to this other research that needs to be done. It is a regional conversation as well. Are we in the same place with it, or is it a totally separate project with different people and different process? Caleb, you got an answer on that one?
Well, I don't know if I have an answer, but I have a response. So my thought is the discussion of competency is a very specific legal process. The discussion about a detox center, state, regional, or local is a completely separate concept. So to me, I'm not saying that they have to be eternally distinct in the way we go about researching them, but they are definitely completely different processes that we should have very separate research, very specific things that we're not. If we had a regional facility for competency and restoration, it isn't going to have any component of the other processes that would go on into a detox facility, so that they're eternally distinct, I guess, in that way. Hopefully that makes some sense.
Yes, thank you so much. Well, let's move on, because we do need to get go through a 3 more topics. And the next one is the one Barry was foreshadowing. So this is to establish a location in close proximity to the jail from which reentry specialists, behavioral health staff, system navigators, and peer support providers can offer reentry support. And it's another exciting recommendation to discuss because, again, there's been some recent progress to conceptualize this project. So if we go to the next slide, this is the place where I'd like to pass back to Tyler. And maybe you could tell us a little bit about this proposal that's been put together.
Yeah, I can speak a little bit more to it. You know, really, in talking a little bit with Erica and others at the Health and Community Services Department, recognizing the value that Waystation is going to bring to the downtown location, but then also acknowledging what our downtown area is lacking, we really wanted to try to further this concept that the stakeholder advisory committee is as kind of identified as kind of a resource center. So how do we find a location in the downtown area to connect all these services, to even provide some reentry services that individuals moving out of incarceration can be connected directly into housing, into work and where it goes, training, and a number of different locations. We have had some discussions with the state legislature in regards to this. I don't think this idea fits specifically to the state's, I'm going to say, interests as it relates to strictly like behavioral health facilities, right? They're very interested in the 23-hour facilities that we talked about earlier. The state's very interested in the community stabilization facilities. I like to say, trying to transfer some of the state responsibilities to the counties, and they will help fund those. But this is more of kind of a service specifically in our county that we really want to try to accomplish in community where it goes. So we tried to define it and provide some additional background to it, to these bullet points. But I'm very interested to hear it from this committee on kind of next steps or additional ideas associated with it.
I see Barry's hand is up, and then Brian and Melora. And Marty, do we want to flip to the next slide yet? Or hang?
Could you stay there just for a second?
Yes, please. Go ahead, Barry.
So on that last bullet, the cafe that employs people exiting jail or currently recently homeless, I ran across, actually, with Heather Flaherty showed me a resource that's called Fair Start, FARE Start, and it's a nonprofit that operates a concept like this on a few different levels. They can go all the way from a full-blown restaurant to a smaller, like, sandwich lunch shop type thing, down to a coffee shop and barista training. And there's a lot around job training that goes on with those programs. So I've been playing phone tag with them. I haven't gotten to be able to talk to anybody yet, but I want to find out more about that program.
Great, thank you. Brian?
Tyler, and maybe I'm thinking about it wrong, but would the new way station offer any of these services, or be positioned to offer any of these services? And I mean, maybe secondarily, have we engaged any of the faith-based organizations in town around providing some of these services?
So I think Way Station is connected yet different, right? It's going to provide some services for homeless individuals, and those are in need. So this will serve this could serve similar populations, but also kind of connecting it directly to some of the reentry and background to where it goes. And your question about faith is a really good one. I don't know if we've had that conversation specifically, but I do think as the mission is looking to expand their base camp facility in their current location, we'll have some components of this as well, and connecting in with them is going to be a very important topic as it moves forward.
Thanks. Melora?
I was just going to add that an idea of a facility like this is really embracing the idea of a warm handoff and what reentry does look like. So we talk a lot about those two terms, but when someone is being released from a correctional facility, for it to be a warm handoff, there has to be someone there to meet them. There has to be a place for them to go. There has to be the ability to sit down, think through next steps, figure out what that looks like. So a lot of our outreach teams already do that. They work closely with the jail to know when someone's being released so that they can be there. But for a lot of folks, they just walk out and there is no warm handoff, or the idea of reentry doesn't exist for them. So it really, those two things, if we're doing reentry in the jail, how is it consistent as they come out of it and are able to then have maybe even some of the same service providers support them outside of the facility?
Thank you. That was helpful. Yeah, Caleb?
So one of the things that I was thinking about in this process is, and I don't know if it's co-located with this or if it's even a possibility in our community, but I saw a program in recovery when I was in Middlesex County a number of years ago called the Phoenix. It's part of a supportive recovery group that does fitness-based recovery components for folks who are in substance use disorder and different levels of recovery. And it had a lot of merit to me at the time. And I would like to see that we at least consider something like this. It doesn't have to be co-located with all of these things, but it might be a good kind of a place to start in terms of this kind of a discussion as well, because I think it's at least something that we should look into. Let's put it that way.
Caleb, could you send us that information, send the link or whatever, so we can see more about it? Yeah, thank you. Eileen?
Yes, this service is similar and parallel to the urgent care in the sense that it is a hub of connectedness of services that need to be bunched together and ought to be, so they can connect to each other quickly and easily and smoothly. So it seems like a really good idea. It's also typical for what are called restoration services for people. This is post, right? Preparation for life on the outside and stability, emotional stability, physical stability. Yeah, it's an excellent idea.
Thank you. Yeah, Peter?
I know that this is just a kind of a smattering of bullet points about a possible facility. I just want the word jobs in there, because when we were in Nashville,
yes,
the Urban League was responsible for helping people connect with jobs and job training and such. And I can see that as a very important component of this facility.
Yeah, thank you. I'm really appreciating too how a lot of the threads that had come up in our discussion at the SAC are, you guys are really speaking these are the same things we need, same values we're trying to advance. So yeah, Wendy?
I would just encourage that we extend, whether it's like an annex to a different facility, that a lot of these things that we're talking about here could be very useful within the facility itself. If the criminal justice system ever kind of gets itself tangled out or untangled, so that they're not waiting until the last minute to get pleas and then people are leaving. So if they're in custody on a sentenced basis for a period of time, that would be a terrific opportunity for us to start working on the reentry services at that point. Help them work on recovery, help them learning job skills. Goodwill's been great. They've come in over at the work center about teaching people how to account for time they've spent in jail or prison and how that won't mess up a resume, and how to interview, and learning a whole variety of things you need in order to succeed in the community. And so that is one of the things we'd be looking for when we were talking about a corrections facility, having a space available for both one-on-one and support groups and all of that. So to an extent, it would be a duplication, and I realize, but I think that we need to consider these when the time comes that we're talking about a corrections facility also.
Thanks. We'll flag that, yeah, for our next conversation. I remember a thing from the needs assessment that You know, like as soon as somebody is incarcerated, we're already starting the planning and processes and support systems for reentry, like from the beginning. Yeah, so Paul?
A thought came to my mind outside the box that our current facility, jail facility, could be one of the possible downtown location for a lot of things we have considered here.
Oh, I just got what you meant. Uh-huh. Right, so that these, if the downtown jail went away, the replacement could be some of these same community-based facilities. Am I catching you? Yeah.
Yeah,
Great.
even the other things we have discussed before, you
Yeah.
know, people to send, it could serve a great purpose for a while until
Yeah.
we alternate plans.
Great, thank you. Yeah. Well, can we see the next slide, please, Marty, if we're ready, and just that.
So Tyler, did you want to look like your
Yeah, I'll speak to this a little bit. You know, as you submit applications or submit funding requests to the legislature, you need to provide some detail, right? You need to provide some property location. But I want to put an asterisk next to the proposed location on this. Really what we were trying to recognize is a downtown location that the county owns that could be utilized for this purpose. This is North State Street. It's a parking lot the county currently owns, which is across the street from the way station, kind of near the WTA bus stop. When we submitted it, that property is available. The county's talked a little bit about what the best overall use would be for it. But as you know, Executive Sadhu indicated, you know, there's other locations in the downtown area that we could use this and this type of facility. It makes me think a little bit more about if it's determined that downtown is not the best location for the jail itself, for the housing units. This is starting to talk about what types of facilities and services need to be located downtown, and essentially located. So I'm really encouraged by the conversations one way or the other about the actual housing locations, and we can make some community decisions about what's needed downtown, what type of facilities meets our community visions for the reentry for the services. And like Wendy said, there should be connection between the two, between the reentry services, the housing services, all the conversations we're going to have next week to what's going to be located in it. How do we ensure that we have something downtown to accomplish the same? So yeah, we submitted this to the legislature for a capital ask. Like I said earlier, it doesn't look like it's going to be put into the capital budget, but that's okay. We still see this as a community need and can determine the best way to maybe fund it locally if we can figure that out.
Great, thank you. Erica?
Yeah, this is really helpful conversation. And I also think it's important to note that this would serve a broader community than just those who are justice involved. This would serve, you know, folks who are experiencing homelessness. It would serve our providers. So when I think about the Venn diagram, this is broader than this particular sort of suite of services is broader than just those that would be imminently exiting the jail. But they're obviously linked and complementary. So.
Yeah, thank you for that. Well, and that's a perfect segue actually to our next section, which again we're going to talk about housing. So let's jump into C3.
Yeah, so both C3 and C4 relate to housing. And so we can lump the conversation together. C3 is it's about the need for additional permanent supportive housing with on-site clinical support and intensive case management for people with severe and persistent mental illness who are involved with the criminal legal system. And the recommendation is to advocate for state, federal, and private funding to expand housing with on-site clinical support and case management for these folks. And on the next slide, there were some ideas from the worksheets that I compiled here. And so they include new housing with dedicated units for people re-entering from incarceration. Then there was mention of Citygate, which is a facility, I think, is it under development or it's nearing completion?
It's open. It's been open for
open.
many years.
Oh, it's open. Okay, for long-term housing. So more of that, or working with them, I suppose, is why that was mentioned. And then another concept is to have more facilities like Sun House dedicated to diversion and reentry. And finally, this is something we talked about in our last workshop, which is adding those PACT or Program for Assertive Community Treatment Services into permanent supportive housing, which is how the model was intended to be, but we don't have that complete model in our area. I'm gonna let's move on to the next slide, which is C4. And this one is about housing for people engaged in diversion and therapeutic court programs. And the recommendation is a very general one. It's just to prevent unstable housing from being a barrier to successfully engaging in those programs. So on the next slide, there were a few comments made in the worksheets about this, and mostly they are just saying we need enough housing options of various kinds to try to help people who are in these diversion programs. To work with, there's housing committees already that exist and help identify new opportunities with them. And like purchasing a hotel or a motel, to ensure that there is adequate case management in these facilities for those higher need residents. So we are talking about housing with supports mostly, and then set realistic expectation for housing for people engaged in these diversion and therapeutic court programs. I believe that's so that that people aren't booted out of the housing very easily, that there's ways of helping provide additional support within that structure, and reasonable expectations for what behaviors are accepted. So I think the next slide is just some discussion questions here, and really we can just open it up to talk about these kinds of permanent supportive housing programs and services needed for diversion, people participating in therapeutic courts and diversion programs.
Marty, could you, or Kathy, can you pop back? Let's just have everybody give them a chance to see. We're combining C3 and C4 because they're all related to this question of the supportive housing that is needed. So go back up to C3, please. All right. So one more. So just everybody's got it in their brain, right? So permanent supportive housing with on-site clinical support and intensive case management for people with serious mental illness who are involved or at risk of involvement with the criminal legal system. So that's the C3. Pop down. And then the recommendation I C4 is prevent unstable housing from being a barrier to successful engagement with diversion and therapeutic court programs. And if you were part of the SAC, you remember that was also, what is I guess I'd say the unique niche that we're trying to address versus affordable housing in general, right? Like housing is an essential need. We know that has to be met by our community. but the subset that is really relevant to our work here. So that's what we're talking about. So next slide, and then let's open the next one more slide. Yeah, here's where we are. So that's the kind of world that we're speaking of, and what feels like the kind of the most important things that we want to be thinking about, additional ideas, how they can fit together, locations, potential funding sources, like how can we really flesh this out? Because we know it's important. Anybody got an idea to get us started? Yeah, Arlene.
I want you to forgive me for breaking your rule that you just stated, but I want to speak to you as leaders in this community. And I have long been wondering why it is that the foundations and charities of our county have not brought together to make long-term planning for housing of people with no homes. I don't understand it. I'm surprised by it. And I hope that some of you will put your mind and your hearts into organizing that. You have the ability to do that, and you know who those groups are. But back to this particular set of goals is shorter term. And I know that that's what you're focusing on. And I only want to support the importance of this. The North Sound Behavioral Health Organization has been bringing in additional funding for a number of the programs. And that is one of the important sources, but we need so much more. Everything that we want to do is dependent on stable housing.
Mm-hmm. Mm-hmm. Yeah. Like to go next. Yeah, Tyler.
Arlene, is North Sound providing funding support for reentry housing, for housing associated with this? Is that what you were indicating?
I have not seen that. No, it's more in treatment.
Oh, okay. Sorry.
And
Well,
some
yeah.
some of them are temporary program. I think there's been some support for like Whatcom Treatment Center. But it's in bits and pieces, but it's moving. That's what I wanted to emphasize.
Great. Hey, who's got an idea? Yeah, Melora.
I was just going to say that I think it's important to remember that we need, and this, I saw this on the last slide, but that we need a continuum of housing options. People are in different places, and signing leases and getting into a legal agreement like that is not always the first step for someone. And so we really need to emphasize that access to safe shelter and housing, that there are lots of ways that people can plug into that. And I think that requires that our housing system works to remove some of the financial funding barriers that we have between not being able to move people fluidly. It's yet another system that gets really caught up in the way we access funding. And so I just, sometimes people are ready to sign a lease and get into that apartment. And sometimes they need something that is more temporary to start. And then as they start doing well, they can look at those other options. So we just emphasize that our whole housing system has to also be part of these recommendations.
Mm-hmm. Yeah, thank you. Stephen?
I don't mean this to be a downer, but all of these ideas quite rightly refer to intensive case management and on-site clinical services. That is an extraordinarily complicated and difficult nut to crack. We had side conversations go on for about a year. Melora was part of those. Mike Parker from the Opportunity Council, Terry Bryant Booth from the Homeless Services Center and Coordinated Reentry System, Lake Whatcom Center, Pioneer Human Services. These are very, very specialized kinds of capabilities. and we don't have these people. This is a workforce issue, if nothing else. So this is so much more complex than just a bricks and mortar facility kind of thing. And it's going to be a long process to develop this. And I think we need to recognize that. That conversation kind of petered out because there was no clear pathway to how we could provide the kind of supports that people in this kind of housing would need. And people much smarter than I are going to have to figure that out.
Thanks. Peter?
Not long ago, I put a significant amount of time and effort into looking at what it would take to do a hostel or a luxury hostel in downtown Bellingham in a commercial or a former retail space. I drew up plans, looked at how it would work, and realized that it was a very similar model to something that would solve some of the problems for both our great need for workforce housing, this congregate model of if really well overseen, and it could really work in some of the empty buildings that we have in some of the spaces, and provide temporary non-leased housing. And so I think that the same model should be considered for this population that we're talking about. There need to be a great deal of oversight, case management and such, but congregate housing, I think, is a solution that we should consider as a community. It just needs a really good provider. So just want to point that out. Thank you.
Thank you. Yeah. Brian?
Wanted to echo a lot of what Stephen offered, and just maybe by way of reminder, we do have examples of some of this type of housing already in Bellingham, and to Peter's point about the on-site management, that to me is key. These facilities are not without their controversy, depending on, I notice we have a bullet here around general location. They're not without their controversy in terms of impact on neighbors and what have you. And so one, I just want to acknowledge that we do have some models, and then two, just if the focus is on the next 1 to 3 years, that gives me a great deal of pause in terms of trying to do things like identify locations, even potential funding. I think we have some of that already today. So we're not starting from scratch, but I think in many respects, this effort is ongoing.
Mm-hmm. Mm-hmm. Thank you. Jack?
I'm wearing a couple of hats today, but wearing the hat of somebody being incarcerated and re-entering, and part of this discussion is about that. It's extremely challenging in the world we live in. A part of my current business background is with real estate and property management, and I've also been someone coming out of jail. And the truth is, if you came out of jail in the 80s, it was pretty easy to get a place because the systems weren't set up to find if you'd been charged with something. But today, there's really a scarlet letter on someone, even with a charge. Non-offender criminal, non-conviction criminal offender data doesn't go away for a couple of years, and that's if you're proactive. And many of the people charged don't have the ability to get rid of it. And what I see in rental screenings and property management things and stories and 12-step meetings is the huge challenge of having been in the criminal justice system as it relates to getting housing, particularly if someone's charged with a crime that most people would find particularly heinous. If it's prescription fraud, there's a different reaction to something more extreme. So one of the elements that has to be addressed, I think here, it's not just getting people to sign leases. And some of you have talked about the communal house or the different forms. It has to be a housing that will take people that probably can't get a lease, that probably have bad credit, that have a criminal history that makes them less desirable. And the problem is, if we don't find housing for those individuals, their likelihood of recommitting and reoffending and staying in the system is really high. So while I don't have the answers, I think that's part of the frame of the problem, is making sure people who otherwise couldn't get accepted at most places have some place where they can be housed. Thanks.
Yeah, thank you for that, Jack. It's reminding me of the continuum of care that we had, or Marty, I'm just blanking that, that. Help me out.
The sequential
Thank you.
intercept model.
The SIM, right? That part, that side of it is absolutely critical. Yeah, Kayla?
Yeah, thank you. I just, I think we all believe this is a really critical component of making this all work and making our community healthy. And I think, to Stephen and Melora and others' points, complicated in terms of the workforce challenges. I think the financial challenges of doing this at scale are pretty extreme, and just want to acknowledge that there's a huge effort at the state level regarding funding for service intensive housing, and just want to encourage us as a group to plug into that conversation. And I'm happy to be that conduit. But I think we need to do some advocacy to make sure that that funding and those models work for Whatcom County, work for the type of housing models we're interested in pursuing, and have limited barriers, to Melora's point, around people to be able to move freely based on where they're at. So just wanted to offer myself up to try to be helpful there, and think that we're not going to be able to do this without some substantial state resources.
Thank you, Kayla. That's really helpful. I thought I saw another hand. Who was up next? Somebody else?
I have a chicken and egg kind of, oh, go ahead, Tyler.
Oh, I was just going to, the type of project that came to my mind is the Sun House community facility. That is, in the downtown location, in a single family home. I think they have 9 different rooms. Now, Sun House is not for reentry purposes. It is kind of an emergency shelter for homeless and behavioral health issues. But, if one of the recommendations was to continue to study and make and research what type of facilities would work in our communities associated with reentry, for those individuals that may not be able to do leases and where it goes, it may be worth looking at the Sun House as a model associated with it.
Yeah, I'm just looking back at that slide. Can we go up 2 or 3 slides here to that there? So the possibility, this is one you're flagging, I think, 3 to 5 more facilities like Sun House, but dedicated to diversion and reentry. Like I said, potentially focusing in on that as a scenario. I'm curious, where did Kayla, what do you, when you look at these, do you think of these more holistically as something we need to explore? Are there any of these that you go, yeah, we could focus on that and really kind of build it out as a potential solution or advocate for it?
I think the sort of Sun House model is a really something that there's an opportunity to do sort of quickly and locally. I think when we need to sort of start thinking at the state level is when we're talking about like really service enriched housing at scale. All that said, I mean, I think we need the funding for these smaller housing models on an operational standpoint is something that I would want to really explore in our funding conversation, because I think that's sort of the linchpin, and then also making sure there's provider capacity to do that. But those do seem like something that can happen in the short term in my mind.
This one in particular, the 3 to 5 more facilities like Sun House, or the whole group of them?
The Sun House
model. Okay, thank you. Tyler, did you have another?
Yeah, I just had one more thing to offer.
Yeah, please.
Sometimes looking at what we are currently doing and making sure that that's fully supported operationally from a housing standpoint in the services is sometimes more important to looking to building new ones. So I think we should really kind of add a bullet point that just recognizes that our current supportive housing facilities, we should make sure that the supportive services that are in those are adequate, and look to maybe fund those first as a short-term effort. I'm not saying we have the money for it. I'm just saying that maybe we should acknowledge that that should be a bullet point and one of the 1 to 3 year implementation strategies.
Yeah. Thank you for that. Peter?
A big thumbs up to what Tyler just said. We really need to make sure we're doing a great job with the facilities we have. My question is, does anyone know or have any idea how large the number is that we would, as a community, need for facilities like this?
Great question. Does anyone have an idea? Caleb, do you have a thought on that? Yeah, Erica?
I think it's really hard to say, but we have hundreds of people between base camp and other encampments that are unhoused. We have that many more. I mean, our point in time count shows, I think, about 1,000 people. And that's just people that we know are either living in their cars, RVs, couch surfing, or unhoused in some other way. So, I mean, that's just scratching the surface of people who also have housing insecurity too, or are in the jail right now and not being counted.
Yeah, thank you. Well, Laura?
Yeah, I would just add that if we use the LEAD program as an example, we have over 100 enrolled clients and 80 of them are experiencing homelessness actively. So those programs that are trying to focus on, the most justice involved, or those like Grace that are most engaging with the emergency systems, easily 60 to 80% of that population is. So just within one program, we have 80 individuals that are unsheltered.
Yeah. Caleb?
And I'm speaking a little bit out of turn because this is not my wheelhouse, but one of the things I think I understand about some of our local faith-based structured housing is that there are certain requirements that people who are in various stages of recovery either are unwilling to or unable to comply with. And so it makes them ineligible for, housing. And so we kind of have to have this moment where we realize that there are people who will not be able to comply with, some of the restrictions in the faith-based housing. And so there's a population out there that is going to need services that otherwise wouldn't.
Yeah, thank you. Scott?
Yeah, I was going to say something earlier and then somehow I lost contact. But anyway, I think I've said this in the SAC meeting before, but we have a global homeless issue. And I think that's part of this discussion. My concern is that if we have housing associated with coming out of jail, we really might have people who purposely do something to go to jail so they can get housing on the other side. Because if it's available there and not in the broader community, why wouldn't you do that? And so there's unintended consequences in my mind.
Thank you. Yeah, Stephen?
Referring back to that extended side conversation I mentioned, and I may need to draw on Melora or Erica to the extent she can channel Ann Beck in her department. There was a big problem when you try to target supported housing on either homeless people or re-entering people, because we have a lot of federal money going into that. And it comes with incredibly restrictive process requirements through the coordinated reentry system. That turned out to be a big obstacle in that conversation because you cannot just give away to individuals outside that selection process housing resources. So that's going to be something we're going to have to tackle in a way that was obviously problematic in that conversation. There was some thought of revising the coordinated reentry criteria or coordinating with service providers for the intensive services that would go into supported housing. But I just want to flag that as an issue that we would have to tackle here as well.
Very nice channeling, Stephen. Anne would be proud.
Thanks. Okay, flip to the, I think it's 3 slides down from this. Yeah. So anything else, or I don't know, are there people who should be part of this conversation who we don't have in this room? Are there steps we can take that will help us? I mean, I so appreciate just people who, it was Kayla saying that she could, I think that was you, Kayla, right? Step forward and kind of be paying attention at that level. Anything else that would just help us move? We know this is a big issue. We know it's not, it's been around for a while. It is it's going to be with us for a while, but what would be most helpful, do you think? And again, are there people who we should be talking to who we don't have in the circle right now? Any ideas? Yeah, go ahead, Michael.
They used to be called the Reentry Coalition. Irene, I mean, she certainly has a great deal of on the ground experience. I just seems to me that when we talk about a reentry center, that hub idea, someone like Irene might be important to include.
Great. Thank you, Michael. That's great. Arlene?
Yes, well, there isn't anybody here representing the homeless groups. And since they are the ones who are involved, it seems pretty important.
Mm-hmm. Yeah, any other ideas? Michael, is your hand back up or is it just didn't come down? Okay, so anything else on this topic? Yeah, Melora?
I would just add that, operators will be a challenge. What agencies are able to staff new facilities and do that work. So just engaging our provider community, housing providers. And we do have the Coalition to End Homelessness, which is, a group that has a pretty diverse stakeholder representation. And when you read about some of the other large urban areas that have really impacted and created a lot of housing and gotten people off of the streets, they use that coalition to really get some of that momentum going. So I know that the Homeless Service Center and Ann Beck's team is highly involved in that. So I think it'd be important that they're involved.
Great. Okay, thank you. Tyler?
Yeah, I was going to say similar to Melora, the people that are already working in housing in our community, right? I mean, we have a substantial, very knowledgeable experts on housing and specific dedicated revenue sources associated with construction and some operations associated with it. So, as Kayla volunteered to make some connections, I think it should be having a conversation with the Housing Advisory Committee that Whatcom County has, that includes the City of Bellingham and includes Whatcom County staff, includes homeless service operators, includes, development committee members, to kind of pose this question to them about, how does it look for housing facilities that may be or may not be for reentry purposes. So that would be a good starting point if the recommendation is to do more research on it. I don't want to duplicate. I don't think we should be duplicating efforts, but we should be connecting into those in our community that are working on it and trying to acknowledge the priority that maybe this committee sees and get their input on how it may affect the overall issue or provide some benefit to it. And the Housing Advisory Committee would be a good first step to that conversation.
Yeah. Well, and I'm really struck by another comment you made earlier, Tyler, about, so for the people who are providing this type of service, you know, supportive case managed housing, what do they need to be successful so that we can start with what we've got this year, even, or in this period, even if we're not investing in new facilities. So the coalition, who's the best link for that from this group? Does anyone have the direct link to that?
Good. Kayla will be able, I'll self-assign Kayla to help follow up with that.
Okay.
For you, Holly and Marty.
Kayla, you excited about that? It's gonna
Yes,
work.
I love talking about housing. This is great.
Excellent, wonderful. Yeah, Deborah, you're up.
Yeah, sorry, I'm off video now. I was thinking have been thinking this for quite a while, that the person that should be included in this discussion is the director at the Lighthouse Mission. I've met her before. I can't remember her name offhand, but I've thought that she would be a worthwhile contributor regarding the homeless population and questions we might want to ask her.
Great. And then doesn't Catholic Community Services also do supportive case managed housing?
I'm not sure.
I think they might.
Yes, they do.
Yes,
Okay.
they definitely do. Yeah.
Okay, so that's another person we could, or potential place to loop people in. So gang, it's 15 minutes before noon. So we're gonna start. Anything else on this topic here? Yeah, so you're up.
One of the thought comes to my mind is that the issue of housing is huge. You just peel this onion, and there's more and more and more. And a lot of issues we are trying to solve in our community, the underlying cause is poverty.
Mhm.
You know, we may not like to admit, we have people in the United States, bottom 25% who are poor, like any third world country. We have poor people who are really poor. And local governments are the first face in front of every citizen, in front of every group.
Mhm.
And that's what we see, and that's where we take our complaints to, and that's where we put force behind it, do something about it. And I think that as a community, we are doing, and we should keep doing more and more. My suggestion is that in all this conversation, we should start putting some capacity or numbers on it, that we will create spot for 200 people. We will make this services which can serve 50 people. I'm just picking numbers, right?
Yeah.
Then we know the magnitude in front of us, what we are trying to solve. Generally, we talk in very generic terms, and that means include everybody. When you start counting the numbers are few hundred to thousands. It need those services, and then we get stuck with that. Did we promise to solve all this problem, or did we promise to solve problem at a step at a time? I wish we had the resources and solve problem for everybody in our community, and everybody who is in purview of our discussion of homelessness, mental health, SUD, all these things. So we should start doing some kind of boundary around ourselves, so we can actually attack that issue and say we achieved this thing. No matter what we achieve, the question from public is going to be, oh, what about those 300 people? What about those people? And we cannot say that we have actually made a difference or solved the problem. So just a suggestion comes in my mind, because where I sit, the perch I have I look at it, it's a huge issue from many directions. And and to comprehend this, we should have some kind of quantification factor in there in our discussions. Thank you.
Thank you. Well, Paul, I appreciate too you bringing up that issue of just really the larger system issue that we're talking about here. And I remember in the SAC, we really grappled with that same question, and hence kind of how we got to the trying to narrow the recommendations. And I also appreciate actually that we did get, people shared some numbers here today. That was helpful to hear. So Kathy, I'd like if you could please go back to slide 14, because I think it'll be helpful for us just to remember what we were doing here today. Deborah, did you want to say something else, or you just have your hand raised from before, or do you want to speak again? Ms. Hawley? Okay, great.
Sorry, I didn't mean to forget to lower my hand.
You
Not
all
this time.
do it. It's totally fine. Okay, so the slide 14 is the one that just kind of frames the go down one more. Yeah. Up. It's the orange one with the, there we go. Okay, so these are the recommendations we are working on today that are really all about this C2, C3, C4, really about how we are going to think about facilities in a way that is, supporting people outside the jail. And as Wendy pointed out, these do dovetail, and a lot of these same services and the same kind of systems that we need also happen within the jail. But these are the kinds of things we've been talking about today. And I'm really grateful that we got more time to talk about it, because during the SAC process, I feel like we really didn't get a chance to explore what these, what the potentialities were to make some change. So thank you all for that. So what I'd like to know, Deborah, are you ready to talk? Do you want to chime in here? Nope. Okay. So what I want to do now is just see if there's any other comments people have about things they'd like to volunteer to help out with, next steps they'd like to see, because we're on the next step section as we wind up our day. Okay, we can take the slideshow down, Kathy. Okay, so next steps. If you have any other comments you want to share that are still, emerging in your head, we had a lot of really important things come up today, so you can add them into the worksheets. As per usual, the more we use the worksheets, the faster we can move, and I think the better plan we're going to have. We are going to meet in 1 week to talk about facilities meaning the jail and accessory to the jail. So that's going to be a really big discussion. Again, if you have thoughts, getting them into the worksheets or emailing them will be super helpful. Attendees, for example, Kristen, you've been coming to every meeting and observing, and feel free to send an email, because we appreciated you so much on the SAC. So, chime in. And and we've got a really big conversation ahead of us. So more thought on the community-based facilities to go, and then moving into the jail facilities. So Paul, did you have a?
Yeah, one more thought, that a lot of work has been done in year 2022, starting the Stakeholder Advisory Committee, now IPRTF. How do we inform general public about the amount of work and directions we have taken? This is from my personal experience over the last month or so. Many different people I met in the community, rural areas as well. People don't really know there are still information from 2017, which is being talked about without knowing that what amount of work has been done prior to incarceration, during incarceration, and after incarceration. I think we need to find a way as we continue to do our work, how we inform general public about it. This came up in our council meeting. There was a request for hiring a outside agency. I think we should be all transparent about it. And then there was a question, and the council attorneys also said that we should be extra careful if we hire an outside party, what kind of information we are giving, because of the public disclosure laws and lobbying laws that is county money is being used for or against certain things. So I just wanted everybody to be aware of that, because this is the people now who are working on the implementation plan, and how should we plan to reach out to public and groups and things throughout our county. So somebody else has more comments on that. You're welcome.
Great, thanks. Barry?
So I'm going to respond to that, and then I think I'm just going to take us out so people can get to lunch. Yeah, the contract that Sal Paul mentioned has been amended. We have been working with the attorneys since the inception of this effort back in, I'd say, November, December. So we're trying to vet every single thing that goes out. But another thing is, yes, tell your friends, tell your neighbors what's going on. I spoke last night to a group from Riveters. I did a presentation for them. I did a presentation for a Rotary group. I'm willing to go to lunches and after work or whatever if you have an organization that wants to see that and be informed. But the idea is we need to be truth tellers and get the information out that we are working on, and it's super important. So there's efforts underway, and what I want to do, just as we leave today, I want to thank you all for being here again. I feel great that there's so much momentum. There's balls rolling already on several of these programs. So I think we can be proud of our work and come back next week, come back with those ideas. There is that's the engine right now, is our ideas and how we get those things into our implementation plan. So again, thank you. We're adjourned.